everyone, and welcome to today's webinar. My name is Portia S. Ray. I also go by Portia. And today we're going to learn about prescription drugs, safe use, storage, and disposal. I have two guest speakers with me today. We have Joe from Rob Ranch, and we have Laura from the Oklahoma Poison Center. They will be joining me today to add their extra special touches to this webinar. House rules before we get started. I would love for everyone, if you could, to show your cameras. If you're uncomfortable, that is okay. And I want this to be an open, inclusive environment for you all to participate. So if we have high participation, everyone gets something out of it. So feel free to participate and add your comments in the chat, participate in our poll questions, and depending on the energy of the audience, we may have an activity, a breakout session at the end of this session. So I want to pull up our first poll question just to gauge our audience and see where you are in regards to the subject of opioids. So our first poll question, which should be on your screen, is, have you ever been prescribed an opioid for pain? I'm going to give you another 10 seconds before we close the poll. All right, good job, team. So for those who are able to answer the poll, I see 100% of you all have been prescribed opioids. That is interesting. I've never been prescribed one, so this will be a good conversation for us. So before
You're not as clumsy as I am.
Yeah, not yet. But before we get started, I want to talk about DECA and our program. DECA is a 501c3 organization. We are in both Kansas and Oklahoma, and we provide social and community services that improve the lives, safety, and health well-being of the people we serve. In specific Oklahoma, our services focuses on opioids, and what my supervisor, Lisa, she'll be our moderator today, and I provide our virtual trainings. One is called Generation RX, which is a training for teens starting from middle school to college level, and we pretty much focus that training on creating role models and helping them identify positive alternatives versus using substances such as opioids. We also provide free Naloxone training for yourself and your staff. So if you're interested in receiving a free Naloxone training, we provide that. For those who don't know what Naloxone is an opioid reversal drug. And what it does is it knocks the opioids off your receptors and gives your body an opportunity to breathe and overcome that overdose that you were in. I will talk more about that later in this presentation, but we do provide free training on that. We also provide free medication disposal bags. They're deter bags. I'm not sure if you're able to see it. I have an interesting background. But we have disposal bags and lock boxes, free for community members within Oklahoma County. And also we have flyers that cites our Naloxone hubs in Oklahoma County and disposal sites. Last but not least, if you are interested in collaborating with myself to revise policies or create a new policy that educate your staff on safe use, storage, and disposal, I really encourage you to reach out to me so I can help you revise your policy. Our guest speaker today, which we have Joe from Rob Ranch and Laura, they will have a moment to introduce their program and provide their resources, but I just want to give you a little bit about DECA so you won't forget about us. Learning outcomes. So what I want you all to learn from this presentation. So one, I want us as a group to identify steps to take in order to safely use, store, and dispose prescription drugs. I also want us to understand why it's important. We hear like you should do this, but really why should we do it? Why is it important to me and my family? And lastly, learn how to dispose of your medication at home and also find local disposal sites near you. So let's talk about the epidemic. So for those who didn't know, the opioid epidemic began in the 90s, 1999 to be exact. That's when doctors were constantly prescribing opioids at a high rate. And at that time, they weren't aware that their patients could become addicted to these opioids and even overdose from it. So the chart you see here is 2015 data, but it kind of shows how one overdose can possibly affect thousands of people. So I'm going to read it for you. For every one prescription or illicit opioid overdose death in 2015, 18 people had been prescribed or had misused a prescription drug, and they had substance use disorder involving heroin. 62 people had a substance use disorder involving prescription opioids. 377 people misused a prescription opioid in the past year, and about 3,000 people were prescribed a prescription opioid. So I don't know if you can see this here. Out of this 3,000, one person overdosed. So for those who answered the first poll have been prescribed an opioid, that could have been us. You never know. So it's very important to know why what we do is important. I want to talk about commonly misused substances. So here you see I have an opioid column, and I also have a non-prescription opioid column. So some opioids are Vicodin, oxycodone, codeine, morphine, and fentanyl. For those who didn't know, opioids are pain medications. They're often prescribed by your doctors, but they also can be illicitly made. Here, I don't know if you see here, I have fentanyl in both columns. As I mentioned, fentanyl and other opioids can be prescribed by your doctor. And in this case, fentanyl can also be illicit and made on the street. So some non-prescription opioids are sedatives, stimulants, heroin, and fentanyl. If you are mixing these substances or mixing it with alcohol or another drug, it can be dangerous to your body and cause a reaction and even an overdose. So if you're interested in learning more about different substances that are commonly misused, I encourage you to go to the National Institute of Drug Abuse website. They have tons of substances, including alcohol and marijuana, that they put in detail data on. So in the chat, I want us to answer this question. How do people misuse prescription drugs? So you can either unmute yourself or put your answer in the chat. So how do people misuse prescription drugs? About 30 seconds. All right, so as you guys are thinking of the answer to that question, I'm going to give you one answer. So a way a person can commonly abuse prescription drugs, and I always tie this back to my athletes, is an individual is taking more than prescribed. So say you're an athlete and you broke your bone, you assume like, oh, if I take more pain medicine, I'll heal faster. But in that case, you're misusing the substance. Okay? Did I get any other comments in the chat in regards to how can people misuse prescription drugs?
You've got a couple other in here, diversion, giving them to others or giving them to friends and family.
That was good. Yes, sharing it. Good. That is a form of misuse. Taking someone else's medication is also a form of misuse. So good job, team. I love that participation. High energy. All right, so now I'm going to pass it along to our guest speaker, Laura. I'm going to have her introduce herself and talk about the Poison Center.
Well, hello. Thank you for having me. I appreciate you putting this together, and I love working with you guys for many, many years. I'm the state education coordinator for the Oklahoma Poison Center, and I know I see a few familiar names that folks I've met before. Hello. When we talk about poisoning and overdose, we get so many calls at the Poison Center. We take about, I can't even tell you the number of calls every day where someone has taken the wrong medication or accidentally hurt themselves with their medication. And often, as you can see on the screen, they've taken too much, they've taken the wrong medicine, they didn't follow the directions or instructions, And a lot of times it's about that combination of medication, that combination where they could have called the poison helpline, the 1-800 number, and asked what to do. Maybe they have been prescribed an opioid and then they didn't take that medication. Maybe they missed that morning dose, so they doubled up on the afternoon dose. And here we go, because they're also taking other medications. So there's a number of things, when we're talking specifically about opioids, that can cause an overdose. One of the things we also see is that someone may have been on an opioid and built up to quite a tolerance, and then they were off of an opioid, went back on it, and tried to start back at that higher dose.
All right.
When we look at calls, specific calls regarding all poisonings, here are some numbers I've pulled these from 2019 for children under 5 years old. Why do people call? What are they most calling about? What is the most common call? And as you can see, it's medication and pain relievers. Without a doubt, this is the same statistic. We see this for every county and most states. This is not necessarily unique to Oklahoma. Medication and pain relievers is the number one reason why we get calls regarding children under 5. And you can look there at some of the others that may be surprising. We talk about foreign bodies. We're talking about button batteries, little objects. I will tell you now that when we do this, our numbers for next year, that cleaning products number is going to be much higher because of people being home and COVID. We look a little deeper at some of the medication calls. When you talk about Xanax, you talked about Valium, that's up in the sedatives. And then back down to pain relievers, it's still the number one call. Of course, Oklahoma, a lot of allergies, a lot of antihistamines in there. But you can always see that's just the same trend we see across. And when we talk about pain relievers, it's not just opioids. I do want to mention things like Tylenol, ibuprofen, and people mixing things, leaving things out where children have accessed them.
Okay, thank you, Laura. I do appreciate the information that you provided from your organization. I do want to tie all the things we learned so far together in regards to the opioid epidemic, how it has affected Oklahoma specifically. And I want to talk about the term stigma and what is stigma. So stigma is a mark of disgrace or infamy, a stain or reproach as on one's reputation. And oftentimes when we hear the term opioids or someone's using pain medication or abusing it or an opioid overdose, we think of someone who is using an opioid illegally to get high. However, there are many reasons people use opioids and many reasons why we have opioid overdose emergencies. And most often we have these opioid emergencies or poisonings because it's accidental or unintentional. People aren't meaning to poison themselves or have an emergency from taking their substances. So opioid overdose emergencies can often occur when a person is taking their medication directed by their doctor. And sometimes patients who have chronic pain can overdose on their prescription drugs by accident, and sometimes people without chronic pain simply can take it and overdose because their body had a poor reaction to it. According to the World Health Organization, they stated that people dependent on opioids are more likely to suffer an overdose. The bottom line is that anyone who uses an opioid for pain control or for recreational purposes is at risk of an opioid emergency. And any household that has opioids are at risk as well. Something that's very interesting that I found out is that households that have children and also has opioids, their rate for child poisoning and overdose is 10 times higher. So if someone in your house have an opioid and a child or a teenager, the rate for a child to get into your medication and possibly get poisoning or overdose is very high. So I want to pull up our next poll question and talk about stigma. And that poll question is, how might stigma and bias create barriers to recovery? So in some cultures and in some communities, we just don't talk about this. We don't talk about, depression. We don't talk about drug abuse. So it's often because like people feel ashamed, or we feel like that's not an important subject to talk about in our communities. So I'm going to give you about another 10 seconds to answer the question, and then we can wrap it up. Okay, so I see everyone got this correct. Good job, team. So it's all of the above. So the question is, how might stigma and bias create barriers to recovery? We have, it causes feelings of blame, guilt, and often undeserved responsibility, lack of awareness and access to naloxone, hesitation to seek treatment, and the answer is all the above. So stigma includes all of those things above. Good job. So before we continue, are there any questions or comments? Okay. Well, if there aren't any questions or comments at this time, I'm going to give the floor to Joseph Maple. He is our Red Rock not Red Rock, sorry, he was with Red Rock, but now he's with Rob Ranch. He's our partner. I had the honor to work with Joseph last year and hear his recovery story. It is a very powerful story, and I recommend we give him the respect he needs to share his story. And if you have any questions for Joseph, we ask at the end of the story, you unmute yourself and ask him questions. So I'm going to stop sharing, and I'm going to allow Joseph to share his beautiful story.
Awesome, thank you very much. Yeah, you're gonna hear a lot of the same terms that have been shared in this presentation in my story here. So just so you know, on the front end, this will probably take me about 8 to 10 minutes. So, if you watch or listen to any of the news media today, you'll usually hear about how many people are dying from the coronavirus. I'm not trying to minimize the pandemic or the effect that it's having on the world, but something you seldom see on the news, unless it involves someone famous, are statistics showing how many people die from addiction. Addiction is a hard term to define. I say that it's a disease which compels a person to repeatedly use substances or engage in behaviors with no regard for the harmful consequences. It doesn't just threaten that person's basic health and safety, as addiction destroys marriages, families, friendships, and careers. There's another pandemic occurring in this country that's been going on since the 90s. Since 2017, and on average each day, over 130 people will overdose on an opioid and die. And when I say opioids, I'm referring to prescription pain medication like Lortab, Percocet, Oxycontin, heroin, and fentanyl. The opioid epidemic touches all demographics. Rich people are dying, poor people are dying, old, young, white, black, Hispanic, all are being impacted. When someone overdoses and dies, it's what's known as an accidental overdose. But if we were to consider other factors, the actual death toll would be much worse. The factors that are not included in these numbers are suicide rates as a result, motor vehicle accidents, domestic violence incidents, the list could go on. As a result, the last 3 years, the life expectancy in the United States has decreased for the third consecutive year. So how did I get here? People usually don't wake up in the morning and decide that they want to do something to ruin their lives. I grew up in a good home, a Christian home. I had a good family, and there was no traumatic event in my life that occurred that made me turn to use opioids. In fact, nobody in my family drank, smoked, or did anything. It seemed like all we did was go to church. But as a teenager, we like to think that we are 10 foot tall and bulletproof. But the reality is that teenagers generally do not know how to deal with the emotional pain of some of their experiences. A skill set that I developed early in life was to suppress my emotions and never show hurt or pain. As a man, that's considered a weakness, similar to the stigma that exists today. But my feelings were always suppressed and internalized, so when I got hurt, I would drink alcohol. Like all things that feel good, once you're introduced to it for the first time, doing it a second time becomes easier and more frequent. I'm going to fast forward here to when I was age 33, and following the birth of our third child, my wife and I decided that I would get the vasectomy procedure, just a minor surgery. But once it was over, I was prescribed pain medicine for the first time. By the time that I had taken my second dose, I realized that I loved the way that it made me feel. I can remember thinking that this is similar to being drunk on alcohol, except nobody can tell that I'm using it. That should have been a red flag or an indicator for me to stop. At this point, I wish someone had sat down and told me the dangers of this medication. I had no idea what I was about to put my family and myself through. I truly believe that there should be curriculum on substance abuse and the effects that it has on people, taught to freshmen in high school, and it should be required for them to take. Eventually, a back injury would lead me to start getting a monthly prescription of opioids. Again, the doctor never mentioned the side effects that I could possibly experience. When opioids are taken daily, the body will develop a tolerance to the drug, which means that you either need to increase the dose or the strength in order for them to be effective. Opioids will also come with dependence. Research has shown that the body can develop dependence as quickly as 14 days. When a person becomes dependent on a substance, you cannot simply stop taking them when you want to, no matter how bad you want. Doing so will result in painful side effects like fever, chills, insomnia, diarrhea, deep aches, and pains. This is what is known as opioid withdrawal, and the symptoms can last for weeks. The only relief that can be found is by using the substance again. So it doesn't take long for life to descend into chaos. All in all, my opioid use would last about 10 years. It's not a lifestyle that can be sustained long term. Once you're addicted to the drug, there are three outcomes. One is that you are fortunate enough to get the right help and to stop. Two, you will overdose and die. And three, you will go to prison for the criminal behavior that comes with addiction. So I started by only taking 3 pills a day for the first couple of months, just like I was prescribed. As I developed, as my tolerance increased, my desire and need increased for more too. And instead of having a conversation with my doctor, I decided to self-medicate and just use more. As was mentioned earlier, the stigma of addiction is alive and well, and I was afraid of sounding like a drug addict in front of my doctor and worried that they would just cut me off. So the next thing I know, I'm running out of my prescription early, and I'm buying pills for $5 a pop off the street. So my tolerance over this time would become insane. It didn't take me long to increase where I was taking 10 pills a day, then I was taking 20 pills a day, then I was taking 30, and it didn't stop. At one point toward the end of my addiction, I was taking 50 to 60 pills a day. That's enough to sedate an elephant. And surprisingly, the medication was actually pretty easy to find. You all mentioned reasons why it is found, and that is true. But throughout the first 6 years of my addiction, I didn't even think that I had a problem. I never considered myself a drug addict. I had a great job, I had a family, a home. I had all of these things, so I couldn't be considered a drug addict. Those people are homeless and they live on the streets. That's not me. My thought was that I could always stop on my own. That was my thinking until I tried. When that didn't work, I continued to use. Instead of talking to someone for help at that point, again, the fear of being judged and outcast, considered weak, always set in, and I did what I always do, suppress it and ignore it. The fear of going into opioid withdrawal is a powerful motivator to continue using. I would do anything to avoid the symptoms. And aside from the physical symptoms, there are also psychological side effects. The opioids rewire your brain chemistry. I was obsessed with the desire to use, and the pills were controlling my life. It had become the most important thing in my life and was all I could think about. Getting out of the bed in the morning was difficult without them. It's like I had a hamster wheel in my head that just continued spinning nonstop, thinking about how to get them, how to use them, how to continue hiding what I was doing. Behavior never stopped. Getting high anymore wasn't even fun. I had to take the medication just to feel normal throughout the day. Buying prescription pills off the street is not cheap either, especially when I started using up to 50 a day at $5 a piece. So while you're trying to do the math there, I'll save you some time. But that's basically $250 a day, $1,750 a week, or $7,500 a month. Needless to say, it was a full-time job trying to figure out how to get the money and continue using. I had run our personal finances into the ground, and so I had to consider other ways to obtain money and medication. One way was to embezzle money from my employer. For a long time, this was a line that I would never cross, until I did. I was in a position because I used to be loyal, I had good character, and I could be trusted. But during my addiction, all those traits went away. I had no morals. I would eventually end up taking tens of thousands of dollars to pay for all the pain medication that I was taking. There were a lot of lines that I thought that I would never cross. I worked in the field group with technicians that would go into people's homes to fix their problems. And so while we're in there working, I would often sneak away and go through their personal belongings, their drawers, medicine cabinets, anything looking for medication that did not get thrown away. People always left unused medication around that I could take. Taking advantage of people who trusted me really made me feel worthless. When this disease has its claws dug in, nothing else in the world matters and no risk is too dangerous. I was basically in survival mode, so in my mind I could easily justify my actions. Just living everyday life was extremely stressful. Using was the most important thing in my life, and I would take advantage of anybody to get what I wanted. I was doing so many bad things I could never go to sleep at night. A guilty conscience will do that. Each night I would cry out to God, pleading for him to help me. I would promise the next day I would wake up, I would try to take the medication right to wean myself off of it completely. But it never worked. By 10 o'clock in the morning, I would have already taken 20 pills. Another failure, day after day after day. And this constant failure would only make things worse. When I couldn't find the pain medicine, I started to take whatever I could find. Sedatives, Xanax, cocaine, it didn't matter. It became harder and harder to keep my addiction a secret. I was in a situation in which I was losing control. I hated myself, I hated what I was doing, but I couldn't stop what I was doing. And this was a dangerous time because I didn't care what happened to me. This is the only period of my life where I thought death was a pretty viable option. I was a completely different person, and I had changed into something that I hated. At that time in my life, I didn't feel like God was with me. Looking back today, I can clearly see how he was working in my life, even while I rejected him. For one, I'm thankful that I didn't die. There were times that I should have overdosed, but it never happened. Amazingly, I never used heroin. Every time I got offered heroin, I always had pain pills. And I was never arrested for all of my criminal behavior, which I should be in prison. My life would change forever in 2016. As I mentioned earlier, I was out of control and using a lethal mixture of drugs. I was constantly making mistakes, and I couldn't keep it a secret anymore. I would start getting written up at work, and everyone was suspicious of what was going on with me. By the time April rolled around, I would eventually come clean with my family about my addiction. And then by May, I found myself on my way to treatment in Minnesota. I went to Hazelden in Minnesota. Once in treatment, my family left me and I was completely alone. The cloudy thoughts started to clear up in my head, and it all hit me, just the weight of everything that I had done. Just unbelievable, the guilt and the shame and embarrassment that I felt. It was absolutely overwhelming. I knew that I needed to make changes in my life, and I surrendered to my disease and I surrendered to Christ. Fast forward to after treatment, flying home, I'm excited to get back with my family and get started on my recovery. I'm sober, my mind is clear, my intentions are good, and I had a lot of wrongs to make right. I was excited to get back to work because I had missed about 40 days, so I felt obligated to make it right. As quickly as I got back, though, my boss put me on a 90-day action plan due to my behavior before treatment. Immediately, I get angry and feel defeated right out the gate. I felt like he was punishing me for behavior that I had already gone to correct. So needless to say, it didn't take me long to start blaming and pointing fingers again and started using again. I quickly realized that I wasn't wanted back at my job and that he was going to do whatever he could to get rid of me. So on August 4th, 2016, I was let go from my job, which I had held for 17 years. I can remember coming home that afternoon, and my wife gets home from work and she finds me there, surprised to see me. She could see that something's wrong with me and asked me what happened. And while I wanted to lie to her like I'd always done before, the only thing that kept running through my mind was God telling me just for once in my life to be honest about what's really going on. So I came clean with her, told her about losing my job and relapsing and using again. The fear of being rejected and thrown out of the house, that's what kept me from telling her what led me to continue lying. But she didn't do any of that. Instead, she gave me a hug, telling me that we were going to be fine somehow, some way. We were going to figure it out. She took me by the hand and we went to a meeting together that night. My life was changing before my eyes, and I thought I would be able to get a job pretty quickly. But it didn't turn out that way. It took me 14 months to land another job. But during this time, I had a thought that I want to help people struggling with addiction. And so I just started looking at what it would take to become a counselor. When I started working this plan, it's amazing how quickly everything came together. I had this thought in December, and by the end of January, I was enrolled in school. I had already had my bachelor's degree, so all I needed was to complete graduate school. So I completed those courses in the fall of 2017, or started graduate school in 2017 and went to work at Red Rock in September 2018, working in their MAC clinic. And started there as a case manager before eventually becoming clinical coordinator. In July of this last year, I did finish graduate school. One of the requirements is that counselors have to complete a 300-hour internship, and I had been doing mine at Rob's Ranch, this is an amazing place. On August 4th of this year, which is my sober birthday, year number 4, Rob's Ranch called and offered me a job as a therapist. And I was absolutely blown away. From the first time that I met with the staff at Rob's Ranch, it all felt right. It just felt like that this was the place that God wanted me to be, doing what he wanted. And everything has felt right since then. And the way that everything has fallen into place is just, too much has gone right just for me to believe it's coincidence. And so it's just an honor every day to get to work with people just like me, and try to help them turn their lives around, because there is hope and freedom and peace that can be found from addiction, but it takes work, and it takes 100% honesty in every aspect of our lives. Any secrets that we keep will always come back to haunt us. So on September 15th, I applied at the counseling board and was accepted to go under supervision, which basically means I'm a counselor now. So it's hard to believe that in 4 years' time that everything in my life has completely changed. And people often ask me why I'm so open to talk about the epic failure in my life. But if those things didn't happen to me, then I certainly wouldn't be in the position that I am today to be able to help people turn their lives around. So I'm extremely grateful to everybody that has helped me along the way. It's not a journey that can be done alone. So I appreciate everybody listening and giving me the time to share that with you.
Thank you so much for sharing, Joe, and congratulations on your promotion. That is awesome.
Yeah, thank you.
So for those who have joined us, our guest speaker, Joseph, just shared his personal story in regards to recovery, and he definitely emphasized why it's important to safely use, safely store, and dispose of your medication.
Yes.
So I want to really dive deep into those 3 steps to safely use, store, and dispose medication. So I am going to start with safe use and why it's important. So before I talk about prevention, I want to give you guys some tips to safely use your medication. So be an active and assertive participant with your healthcare provider, your doctor. Make sure you ask them questions at all times in regards to the medication they give you. Is it the best for you? Are there non-opioid options? And also ask them why you have to take it. And also the dosage as well. Keep a list, updated list of all your medication and supplements you're taking. That includes over-the-counter medication, vitamins, your pain medications. Write it down and know where your list is at all time. When you are getting a refill, bring that list with you and talk to your professional healthcare provider or the pharmacist about current substances you are taking. Lastly, when you are being prescribed a medication, you want to always read and follow the instructions on the label to its entirety. Make sure you don't misuse it by taking more than prescribed, and also be aware of the side effects. So if you're taking a supplement or a pain medication, does certain foods, beverages, or other medication cause side effects if you combine the two? So keep note of that. So let's talk about prevention methods. So when you are using your medication, you never want to share your medication with anyone. What is for you is meant for you, and it's very important because I don't know if you guys noticed, if you're sharing your supplement or any drug, that is illegal. And if you're caught, you will have to deal with legal consequences with law enforcement and etc. So you never want to share or sell it. You also never want to take prescription medication that is not prescribed to you. So that kind of ties in with not sharing it. So if someone gives you their medication, you don't want to take it because you don't know how your body will react to it. It might be a high dosage that your body can't handle. You never want to mix your medication with an alcoholic beverage or any other pain medication, so be aware of that. You never want to take other drugs such as depressants, sleeping aids, or anti-anxiety medication or cold medication because that can be dangerous when you're mixing that with an opioid. And always tell your healthcare provider about all medications and supplements you're taking. Safe storage and why it's important. So as I mentioned in the beginning of this presentation, DECA, which is the organization I work for, we provide free lock bags that you see here in this picture and lock boxes to you. So if you need these resources, please contact me. If your organization or community partner need it, we can provide that to you all for free. If you're in Oklahoma County, it's even better for us because it follows our grant requirements. So safe storage and why it's important. So keep your prescription drugs in a secure and locked location at all times. So in the beginning, we were talking about having house guests and children in your home. I know I'm guilty of it. Whenever I get my medication, sometimes it's just sitting on my bathroom counter or in my medicine cabinet. Easy access, right? So if we have it in a locked, secure location, house guests and children won't have access to it. And that's where, you know, we eliminate the opportunity for overdose or poisonings in our household. So know where your medication is at all times and keep your prescription pills in its original bottle. So I know some people use those organizers that have the days of the week, Monday, Tuesday, Wednesday on it, and they just dump all their medication in there. That's fine. However, you still want to know what you're taking and how often you're taking it. So that's where in the beginning I mentioned like write a list. So make sure you keep that in the original bottle if you can with the label attached. And if you have a child resistant cap, that is also very helpful if you have children or grandchildren in your household. Lastly, keep track of how many prescription pills are in the bottle and how often you're taking it. So if you notice anything is missing, that's something just to be aware of. Safe disposal. So let's talk about safe disposal at home. So I know we're living in interesting times and we're all indoors and it might be difficult for us to go outside. So if you have a ton of medication at home, you can safely dispose at home. So what you can do is you can take your leftover medication. I say find an unattractive object such as gardening dirt, kitty litter, coffee grounds. Put that and your medication in a bag, mix it up, and then you can throw it away. I recommend you scratch out all personal information and you can dispose of the container as well. If you are able to travel and go outside and be free, you can dispose of your medication at a local pharmacy or police station. At the end of this presentation, I will provide a flyer with all disposal sites in Oklahoma County. It has their address, phone number you can call in advance if you need to, but those are great places to dispose of your medication. Also, you can go to a CVS or Walgreens as well. They accept leftover medications as well. I do recommend not flushing your medication down the toilet. So for all of my environmental people or eco people, when we flush our medication down the toilet, it affects aquatic species. And if you think about the food chain, if the little fish eats the medication, then the big fish eats the little fish, it all comes back to us humans. So we want to keep our waterways safe and clean at all times. As I mentioned earlier, I'm going to pull it up again. Hopefully you can see it. DECA, we provide disposal bags. Hopefully you can see it. If not, I'll send more information on this. But with the disposal bags, it is environmentally friendly and you can dispose at home. What you do is, again, you put your pills, patches, or liquids in this little bag here, add water, zip it up, mix it up. It deactivates your medication and you throw it away. Again, it's biodegradable. If there's any questions, feel free to put it in the chat and I can answer it. Also, we have Okay, I'm Ready. So I'm gonna share my screen and show you the Okay, I'm Ready website in a moment. All right, can you all see the Okay, I'm Ready website? Let me know in the chat or you can unmute yourself.
Yeah, we can see it.
Sweet, awesome. So this is the Okay, I'm Ready website, and here you can get a ton of resources on where to find naloxone, which is an opioid reversal drug. It's a nasal spray form, and also where to find community partners such as DECA or Rob's Ranch. So here, in order to know more about what we do, you can go to prevention. Waiting for it to load. Pretty much it sums up what we talked about in this presentation in regards to, you know, never sharing, safe use, a little bit about what are opioids. And if you go to the very bottom here, you can just put in your zip code and click on the little arrows and it'll tell you like your local prevention partner. So DECA's on here if you put in our zip code, but you can find us there. Also, if you go back up to the menu button, scroll to Opioid Overdose. If you are searching for free naloxone kits and you don't know where to go, again, come to OK, I'm Ready. Scroll all the way down to the bottom, put in your zip code, and it will locate the closest naloxone hub near you. If you're interested in a naloxone training, myself and Lisa do provide how to administer naloxone trainings, and we go through it. If you're not able to attend, I do recommend coming to this website and they will break it down for you. All right, are there any questions so far? All right, again, don't be shy. You can ask any questions. All right, so I wanna, again, have a lot of participation for this. I'm gonna describe a scenario of, again, prescription drug safe use and safe storage. So in this scenario, we have Ron and Judy's grandson, and their grandson has access to Judy's medication. So here we go. Judy and Ron take care of their 3-year-old grandson, Oliver, in their household for about 2 to 3 times a week while their daughter is working. One morning, Judy goes to the kitchen to make coffee. When she comes back in the living room, she finds Oliver sitting on the couch with her purse open, holding some of her pills in his hand. Judy can't tell for sure if he swallowed any pills, but he is acting normal. So should Judy call an emergency or should she not? So to start our discussion, I want to let you all know that 1 in 10 children are living with their grandparents or a guardian, and 13% of grandparents are relied on as trusted caregivers. So feel free to unmute yourself. Do anyone here live with their grandparents or take care of their grandchildren? For me, I used to live with my grandma, so I'm not ashamed. I'm one of those. Anybody? I can't see you, so hopefully you got your hand raised. All right, so for those who are taking care of their grandchildren or was a teen living with their grandparent, which was me, you know, we were at risk. All right, I want to add to this. A couple of years ago, a study was found that in over a third of cases where children were with their grandparents or living in a household with medication, some of them had access to these medications. So a third of these children living with their grandparents or in a house with medication, they had easy access to it. So why do you think it can be harmful for children or teens to take medication in a household? So why is it harmful for them to have easy access and take medication? I'm gonna give you guys about 30 seconds. You can unmute yourself at the same time if you want to answer the question. So repeat. So why do you think it can be harmful for children or a teen to have access to medication in their household? Why is it harmful? Do I have any comments in the chat so far? Okay. So, go ahead, Lisa.
I see one coming in that says they can easily overdose, and don't forget those with cognitive issues, their safety needs are similar to toddlers. So either children with cognitive issues or adults with cognitive issues. The safety of that medicine being properly marked and stored is super important.
Agreed. And I will definitely add to that. If you think about like little children, like grandchildren, like they're smaller people. So like their tolerance to that medication is completely different from an adult. So that can be an easy poisoning or overdose that occurs. Good job. All right. So this next question, feel free to continue to add to the chat, by the way, is What would you do if one of your grandchildren or a house guest comes to visit and gets into your medicine? So what would you do in this situation if a grandchild or a house guest gets into your medicine? I'm gonna just do a hint. We have a person, a guest speaker. You should probably call just in case. Just put that out there.
And do you know that this person? Do you have a suspicion, or do you know that?
Let's say you have a suspicion. So, like, if in this scenario, like the grandmother noticed the grandson had the pills, but they don't know if Oliver took them. But what would you do in the scenario if a young child or a teenager or a house guest had access to your medication?
I'd ask them if they took it.
Ask.
Yeah, I think confrontation is important and probably doesn't happen enough.
I agree. I put in my notes, I'll educate them on the harm of misuse and abuse. If they're an older individual, like they're not a child, like a teen or up, I'll educate them on it.
Yeah.
So I will offer up a real life example of this. Similar, I had my son who had substance use disorder go over to my mom's house, and she was prescribed opioids, and he would take them and either take them or sell them at the time. And my mom, all of a sudden I noticed that, and I helped with her pills. The pill bottle was emptying quite quickly, and I really didn't think my mother was taking those. And sure enough, we later discovered that that's what was going on. But at first I was just aghast that my son would even do that. Of course, I later learned that he had a problem. But, at first it was like, oh my goodness, I can't believe that he would do that. He would do that to my mom. But I think as Joe and his incredible, amazing recovery story, can attest to, when they're in their disease, they'll do anything, and that's what my son was doing. So.
Thank you, Virginia. I do appreciate you sharing your personal story, and like just the awareness about it as well is very important. Just knowing, like as I mentioned with safe use, like keeping track of your medication and storage, like where is it at all times. So thank you. One thing we were missing here is calling the poison center in a scenario. So if we had a grandchild with medication, we don't know if they took it or not, we should definitely call the poison center just to figure out what to do and next steps. Yeah.
Yeah, I would call regardless. If that child weighs 40 pounds, and depending on what the medication was, we would want to assume that they took, maybe it was a heart medication, or could have been an opioid. There's some diabetic medications. And if we, depending on the medication, want to assume that they've taken it so that they can be monitored and watched or sent on to the emergency room. So it's important to call and ask. It doesn't have to happen. It doesn't have to be an emergency to call. You can call with a question like, this might have happened, and find out what to watch for. We'll call back to the house. Our pharmacists and toxicologists will follow up. They'll say, okay, we're going to watch this child at home. We're going to monitor and see what may occur. Watch for these symptoms to decide if they need to go on to the hospital or not. And also what you mentioned about strangers coming into the house, like repairmen, helpers. I had a lady who had a carpet cleaning company come in and stole some of her medication. They tricked her by saying, I need a small measuring cup to measure the chemicals to clean the carpet. And so she went to the kitchen and got a measuring cup, and he said, no, I need a tiny one like that comes with medicine, because he couldn't figure out where her medicine was in the house. People are tricky, and they can they could pull anything to try to find out. She had her medicine in a hall closet, like a hallway cabinet with towels and things. And that's where she went to get the medicine cup, and that's where he found out they were. This person knowingly stole her medicine, which she obviously figured out within the day, and was arrested and fired from his job. But that just shows how strong that addiction was, that he was willing to do those things.
Yep.
Thank you for sharing that. I'm sorry, Joe, did you have something to add?
Oh no, that's so true. I mean, that's the sort of thing I would have done. Very manipulating people in that addiction are.
Yeah, realtors, thanks for mentioning that too. Realtors, helpers that you think are helpers. You know, you just have to assume that this is going to happen because of the extent of the
you never know.
The problem with opioids in our state, that you need to assume that even if they're not the person addicted, that they may be also someone who just has figured out how to sell them and make money off of them. You know, there's two kinds of folks in that situation sometimes.
Yep.
So.
Again, thank you everyone for sharing and adding to this discussion. So to wrap up this scenario, just to recap, Judy's grandson had access to her medication, her purse, which is out in the open, and the young man had her medication in his hands. So based off this scenario and other scenarios, what are some other reasons why it's important to safely store your medication? So why is it important to safely store your medication is the question.
Well, people are thinking about adding other stuff in the chat. I just thought the natural additions from our previous section were really helpful for this, but I'm also thinking as a mom of a toddler, that's another reason, whether that medicine's an opioid or not, he could still get have an overdose or a poisoning from any regular medicine that might be in my house. Because like you said, he's a lot smaller and his body isn't prepared to take those medicines. So that's another, even if you don't have an opioid or a controlled substance, anybody you don't want getting in those medicines accidentally is a good reason to safely store.
Agreed. And think of, you know, having those guests, like you don't want them to misuse or abuse medication. And for the young people, the younger people, you know, they think it's candy, you know, especially this like different color pills, like they assume it's candy, so they don't know. So a child could take the whole bottle and that could be a situation, emergency. So that's many of the reasons why it's very important to safely store your medication, in addition to the stories that were shared.
I think with this scenario, it highlights something else that's very important, which is what we call a poison purse. And that's a little term we use in poison centers. You know, we've seen so many sad, terrible, tragic kind of situations where family is getting together for some celebration, you know, in-laws, outlaws get together, family, cousins coming together. This is, you know, obviously pre-COVID, and grandma, cousin, aunt, whomever has their purse sitting out and no one's paying attention because everybody's busy kind of socializing. And then a beautiful family day is tragic when a toddler or someone gets into a pill organizer. If you think of a pill planner with the days of the week, that is like a block or a toy with candy in it. And so I personally do not like pill organizers in purses. I don't like the idea of them, but we know people use them. So we like to teach that you would offer your guests a safe place to store their purse while they're at your house. If there's a lot of people, everybody's getting together, maybe throw everybody's jackets, coats, purses in the back bedroom, you know, that kind of deal. But then the kids go back there to play. So we've seen these tragedies happen with some pretty strong medications and opioids in small children because of a purse of a guest.
Yes. And to add to that, what can you do as an adult and patient? So I kind of covered on this a little bit, but when you are visiting your doctor or pharmacist, I encourage you all to always ask questions and get more information on medication you're taking. So some questions you should ask is, why do I need this medication and is it right for me? Are there non-opioid treatment options? Can this treatment interact with other medications? Feel free to share your personal family history of addiction with tobacco, alcohol, and other drugs. And lastly, which is kind of wrapping up everything, what should I do with unused medication? So that's that safe disposal piece. All right, so real quick, because we're short on time, resources are available to you. So for those who've never heard of 211, this is a free service that connects Oklahomans and other people across the US with resources, where to find free naloxone, treatment, counseling services, and it's available 24/7. So again, as I mentioned, this is naloxone here, the nasal spray version. There's multiple versions, but we're gonna talk about the nasal spray version. It's the opioid reversal drug, and it's used again to relieve individuals from that high and to gain consciousness and breathe again. So if you're interested in a naloxone training, feel free to email me after this and we can talk about how I can train your staff. We have Rob Ranch here. We have Joseph, who is one of their treatment counselors. Again, you can go to their website or give them a call. I'll have Joseph's information at the end of the slide if you want to contact Joseph directly. We have the Poison Center and the Poison Center line. If you have any questions in regards to poisonings or a situation that happened in your home, call them as soon as possible. And then lastly, I showed you the OK I'm Ready website where you can get more information on disposal sites and naloxone hubs near you. So some takeaways that I wanted you to get from this presentation are the following. Be a participant. Make sure you talk to your healthcare provider and ask questions. Read labels and follow instructions on your prescription drugs. Write them down just so you know what you have and how many you have in the bottle. Keep them in a locked location, away and out of sight. So again, DECA provides lock boxes and lock bags for you for free. Know where and how to dispose of your medication. So in Oklahoma, we have these cool disposal containers, looks just like this. And then lastly, be prepared to know who to call. So feel free to call the Poison Center, 211, Rob's Ranch, other treatment centers when you need assistance. And this is our contact information. So you are welcome to take a screenshot of this or email me directly and I can share everyone's contact information. But as we wrap up, again, I want to thank everyone. I want to thank Joseph and Laura and Lisa for being a part of this webinar and helping it come to life. And I want to thank the participants for joining us. So I'm going to open the floor for questions. And then after questions, you are free to go. Okay, I see Laura put her information in the chat. Thank you. Are there any other questions from the audience? You are welcome to unmute yourself as well.
That's a good question. Said inhalers, is that what she asked?
Yep, inhalers, injectables.
And those can be tricky because a lot of the disposal boxes don't have a way to take those. Some pharmacies have like a Sharps box mounted on the wall next to their like MedSafe or med container, but not all of them do. I would say they're probably a bit more common at like a Walgreens or a CVS than a family pharmacy, the Sharps containers, but they're still not necessarily widespread. Liquids, I think some of the police departments, because OBN comes to get it, may be able to take liquids. But Laura, do you know have any other insights on as far as liquids and inhalers?
I don't know of anyone that does take liquids, but we just tell people to pour them into like kitty litter or coffee grounds and dispose of them that way with liquids. But inhalers, I get asked that question all the time, and I just quite honestly don't know the answer because, like you said, it's hard to find a place to take those items.
Real quick, again, I bring this up sometimes. So with a deterra bag, it does take liquids. Like this tiny bag takes like 2 ounces, but we have larger bags as well that takes like 16 and like more ounces of liquids. If you need to dispose of your liquid medications, feel free to reach out and we can provide those to you as well. Are there any other questions before we wrap up?
Put your email there in the chat if anybody wants to request a deterra bag. We can't ship them, but you could come visit us in mask and get a bag.
Well, all right. Well, thank you everyone again for attending today's webinar. I will follow up with you via email with the evaluation link and again, additional resources on where to find naloxone and disposal sites near you. But I hope you guys have a great day. Thank you again to my awesome speakers, and we hope to see you at our next webinar.
Thank you.
Thank you.
Bye.
Bye.